Picture this. You're turning 65 next year, and suddenly everyone's talking about Medicare enrollment. Your mailbox is flooded with confusing brochures. Your friends are giving conflicting advice, and you're worried about making a costly mistake that could affect your health and finances for years. Sound familiar? You're not alone. Today, I'm going to explain Medicare in simple terms so you can make confident decisions and avoid the expensive penalties that catch thousands of people every year. By the end of this video, you'll understand exactly what Medicare covers, when to enroll, and how much it costs. More importantly, you'll know how to choose the right coverage for your situation without getting overwhelmed by all the options. Medicare has 4 main parts. Think of them as building blocks for your healthcare coverage. Part A is hospital insurance, and here's great news. If you've worked for at least 10 years, it's completely free. Part A covers hospital stays, skilled nursing after a hospital visit, and hospice care. You'll still pay a deductible though, $1,676 in 2025 each time you're hospitalized. Part B is medical insurance covering doctor visits, outpatient care, and preventive services. This costs $185 per month in 2025. But if you earn more than $103,000 as an individual, you'll pay extra. Parts A and B together are called Original Medicare, but here's the catch. They don't cover prescription drugs, and there's no limit on how much you could spend in a bad year. Part C is Medicare Advantage, which is a private alternative to Original Medicare. These plans usually include prescription drugs and extras, like dental or vision coverage. Many have 0 monthly premium beyond Part B, but you'll typically need to use their network of doctors and get referrals for specialists. Part D is prescription drug coverage, and this is crucial. If you don't get creditable drug coverage when you're first eligible, you'll pay a penalty for every month you go without it, forever. Even if you don't take medications now, consider getting Part D because you never know what the future holds. Timing is everything with Medicare. Your enrollment window starts 3 months before you turn 65 and ends 3 months after, giving you 7 months total. Miss this window, and you could face penalties and coverage gaps. If you're still working with good employer insurance, you might delay enrollment, but make sure you understand the rules completely. Now, let's talk about your 2 main coverage paths. Path 1 is Original Medicare Plus supplements. You'd keep Parts A and B, add a Part D drug plan for about $40 to $50 monthly, and consider Medigap insurance to cover deductibles and co-payments. Medigap costs vary widely, from $100 to $400 monthly, depending on your location and age, but it gives you freedom to see any doctor who accepts Medicare. Path 2 is Medicare Advantage, which replaces Original Medicare entirely. Many plans cost nothing beyond your Part B premium, include prescription drugs, and often add dental, vision, or hearing benefits. However, you'll typically need to stay within their provider network and might need referrals for specialists. These plans also have annual out-of-pocket limits, which can be both protective and costly depending on your health needs. Here's what most people do and realize. Medicare doesn't cover long-term custodial care like help with bathing, dressing, or eating. It only covers skilled nursing for limited periods after hospital stays. This is a massive gap in coverage that surprises many retirees. Let me share 3 money-saving strategies. First, if you have employer insurance at 60, you might delay Part B to avoid unnecessary premiums, but get the timing exactly right to avoid penalties. Second, when you first get Part B, you have 6 months to buy any Medigap policy without health questions. This is your golden opportunity, don't waste it. Third, review your Medicare Advantage and Part D plans every fall during open enrollment from October 5th 10th, because plans change their benefits and costs annually. The biggest mistakes people make. First, missing enrollment deadlines and facing lifetime penalties. The Part B penalty alone is 10% of the premium for each year you were eligible but didn't enroll. Second, assuming Medicare Advantage is automatically better because it's free, those plans can change dramatically each year. Third, underestimating healthcare costs in retirement. Even with Medicare, the average couple might spend over $300,000 on healthcare throughout retirement. Here's some good news. Medicare covers many preventive services completely free, including annual wellness visits, cancer screenings, and various vaccinations. Use these services to stay healthy and catch problems early. If you're approaching 65, start planning 6 months early. Contact Social Security about enrollment, research plans in your area, and consider working with a licensed Medicare specialist. Don't rely on friends' advice because everyone's situation is different. Remember, there's no perfect Medicare plan for everyone. Your best choice depends on your health, medications, preferred doctors, and budget. The key is understanding your options so you can make informed decisions. Medicare might seem overwhelming, but you now understand the basics. For parts working together, 2 main coverage paths, critical enrollment timing, and common pitfalls to avoid. Most importantly, you know this is about taking control of your healthcare future. You're now better prepared for Medicare than most people who are already enrolled. With this foundation, you can confidently explore your options and make decisions that protect both your health and your wallet. Remember, Medicare planning is a one-time event. It has an ongoing process that requires staying informed and reviewing your choices annually. Your Medicare journey starts with understanding these basics, and now you have the knowledge to move forward with confidence. In our next videos, we'll dive deeper into choosing between Medicare Advantage and understanding costs in detail, and planning for healthcare expenses in retirement. Subscribe now so you do. Miss these essential guides that will help you master Medicare and secure your healthcare future.